All right, so I'm here today to talk about the settings of ventilators. So the ones that the book talks about the most is your tidal volume, your respiratory rate, your FiO2, and your modes in which you would have a patient on. So your tidal volume is in milliliters, and we base that off of weight. It's 6 to 8 mils per kilo, and so that's just the full expansion of the lungs. So the total volume in which our lungs can expand out to. That can vary between different kind of lung compliances. If we have a high compliance, we have good elasticity of the lung, and then if we have a low lung compliance, it very well could be lower. And so we want to watch how much tidal volume we're actually giving these patients, and we want to give them appropriate amount. So that's tidal volume. Respiratory rate we know is normal is 12 to 20, and so that's kind of it's patient to patient, depending on their ABGs and stuff. We may want to increase the rate. Let's say if they're a COPD patient, we want to blow off more CO2, we may have a higher rate, or if they already have maybe too low of CO2, we want to drop that rate a little bit. So that's respiratory rate. FiO2 is the fraction inspired oxygen, so that's just the percent of oxygen in which we are giving to the patient. So we know 21% is room air, 100% is full, 100% of oxygen. We're giving them 100%. So that usually varies patient to patient, what kind of oxygen demands that our patients have. And then we go into our modes, which I know another group is going to go over more in depth on these modes, but we have our synchronized, intermittent, mandatory ventilation, which is basically the predominant of that is to wean. So if we want to wean a patient off a vent, we would use that. Assist control, there's a preset volume, and we're basically doing all the assistance for the patient. Pressure support, it's kind of how it says right there. We're just supporting that breathing. Maybe they can breathe on their own, they can trigger their own breaths, but we're just giving some supportive pressure. And then continuous flow is just continuous kind of positive pressure. And so that is to help with people that maybe aren't getting that full lung expansion. And then you have your adjunctive modes, which is PEEP. So that's the positive end expiratory pressure, which the means of that is just to open up the alveoli after expiration. And then you have your bilevel on the vent, which is kind of helps with inspiratory and expiratory. You can decrease your inspiratory and increase your expiratory, or you can decrease your expiratory and increase your inspiratory. So those are things that we can do with the vent, and these are your ventilator settings.